I want to begin with a small disclaimer that all names and some details have been changed to protect clients' privacy and identity. Also, as a multicultural health navigator, I am biased towards my clients and their stories. Those stories need to be heard, and beyond symbolic gestures, I believe systemic changes are needed to ensure real changes for the people in these stories. Samira. Samira is an Arabic-speaking trans woman who grew up in an occupied and indigenous territories in the Middle East. She had to go to the occupying state to access healthcare. She had a rare disease and had to go across the globe to get treatments. She was one of 5 people to get a rare procedure to save her life. She was the only one who survived that operation. Samira ended up as a refugee in Canada. At some point in Samira's life, she lost her front teeth. One of Samira's goals when she moved to Canada was to get her full smile back by fixing her teeth. Samira was surprised that it would take her over 3 years to get those teeth replaced. She had to save and mostly pay out of pocket because social assistance only covers a small part of these essential procedures. After a week of finally getting her front teeth replaced, she was admitted to the hospital for another health concern. During her stay, as she was eating a meal, she took out the dentures of her front teeth and placed them on the table by her tray. When she got up to use the washroom, she came back and couldn't find her front teeth dentures. She asked the custodian, the nurses, the staff, but she couldn't get any leads on how to get her teeth back. And none of them provided any comfort. Samira got extremely emotional, sad, and angry. The hospital staff did not bother to offer the language interpretation services or to find an interpreter over the phone to better communicate with her. It is important to highlight that all of these interpretation services are already offered at the hospital. In short, the nurses and hospital staff did not attempt to communicate with a deeply distressed client in their own language. Imagine if that had happened to a Francophone patient in an Anglophone hospital, or vice versa. Following her emotional and understandable emotional outburst, Samira was treated even worse by the staff. One provider even labeled her as someone, and quote, is pretending, end of quote, in order to remain at the hospital and waste public resources. After losing her teeth again and her health concerns still unaddressed, Samira was forcibly discharged from the hospital. Amir. Amir is an asylum seeker who fled his home country, finding refuge in Canada. He found a job in his same career that he used to do back in the motherland. At one point, Amir was in dire need to get his family doctor to write him a note supporting his long-term leave from work. While Amir was able to secure a job as soon as he arrived to Canada, his traumas of forced migration prevented him from working. He needed to take a break to address his mental health and well-being. When I called the family doctor with Amir on the line to facilitate communication, the receptionist scolded Amir for not showing up for his previous appointment. The receptionist said, and quote, the doctor put a note on this patient's file and that he needs to pay the no-show penalty before booking any future appointments. And end of quote. I had to advocate for the client at the same time while providing interpretation so that Amir was aware and could speak for himself. After significant back and forth, I asked the receptionist, بتحكي عربي? Which is, Do you speak Arabic? It turned out that she could understand us this entire time. Then she ended the conversation with, I will check with the doctor and call you back if he can approve this appointment. Reflections as a multicultural health navigator. Despite all of these barriers, I had to get creative to find solutions for Samira to replace her front teeth and for Amir to get access to his family doctor. But these temporary solutions are really not enough to help people like Samira and Amir. We need systemic changes in healthcare. In the same ways that hospitals, clinics, and their staff offer language-specific care for Francophone and Anglophone patients, they also need to treat all folks from diverse backgrounds, diverse language and ethnic backgrounds equitably. They need to offer the language interpretation services already available in their institutions and not treat newcomers as burdens. Frankly, it is disappointing that even a receptionist who speaks the same language as my client refused to assist the client in their language. What happened with Samira and Amir aren't isolated incidents. I see it happening all the time. This is not a case of, unquote, bad apples working in the healthcare system, but rather we need to ask, were the hospital staff adequately trained on how to access interpretation services already available at the hospital? Were they adequately trained on how to offer culturally centered and anti-racist care? Or was it simply a box-checking exercise kind of training? I encourage you to be an active ally and not just a part of the box-checking exercise that allowed Amir and Samira to fall in between the cracks. The services were already available. Systemic racism, language barriers, xenophobia, transphobia, and more challenge newcomers' existence every day. How can we all work together to lighten this burden through Canada's healthcare system? My name is Marcus. I'm a multicultural health navigator at the Ottawa Newcomer Health Center. I have the honor to serve people like Samira and Amir on a daily basis. I see their challenges. I help them get the knowledge and secure the connections to get over those challenges. At my workplace, we pride ourselves on having an anti-racist, anti-oppression policy. I use every opportunity to challenge systemic racism within my organization and beyond. And I look forward for all of us to work together towards a better future for newcomers and for all. Thank you.